Blindness separates us from things. Deafness separates us from people. A quote from Helen Keller that is on the wall here at Hearing Well Matters. We are in Burlington today. We are right on Maple, just off of Maple Avenue. And I'm being joined by Rob, who is the founder and owner of Hearing Well Matters. Thanks so much for having us, Rob.
Great, thanks. Good morning, Em.
It's good to be here with you again. I always learn so much whenever we visit, whether it's about why you need to clean your ears, the latest and greatest in hearing aid technology. Let's first talk a little bit about the clinic. Why do people need to come here?
Well, the clinic's called Hearing Well Matters, and we named it that because it turns out that hearing is really, really important for day-to-day communication, but it's also really important for how we age. The single biggest cause of hearing, cognitive decline is hearing loss.
Wow.
So it's really important to get your hearing tested, and if you have hearing loss, to get it treated in order to stave off things like dementia.
Now, when people go to their doctor, does their doctor refer them to you, or is this just a standalone where people should be coming on their own without a doctor's referral?
We do get referrals from doctors' offices, but people are also able to come and get tested for free by just calling our office and speaking to our fabulous assistant, Jess Phillips.
Hi, Jess.
Hello, good morning.
That's amazing. So how often do you recommend people get their hearing tested?
They should get their hearing tested annually after the age of 50.
Okay.
And that's a good idea because hearing loss happens progressively and gradually. So it's good to get it tested regularly so you can understand how fast it might be declining.
Is it painful to get your hearing tested?
No, we try to make it as painless as possible, and it's free. So there's no charge at this clinic for getting your hearing tested.
And then once they get their hearing tested, you can of course educate people on kind of the next steps.
Yeah, then we work with the family doctor to, if the patient needs treatment for the hearing loss, to make sure that they get the right type of treatment.
Yeah, well, it's a very welcoming, warm environment. It's easy to come in and get your hearing tested right here at Hearing Well Matters. Such a great name for a place. It really is. Okay, there's so much more coming up on Morning Live. Don't go anywhere. May is Hearing and Speech Month, Hearing Well and Speech Month, and what you're looking at is the inside of my ear. Rob, talk to us about this.
So this is a video otoscope. This is something that we offer all our patients as a standard procedure. We look in the ear in order to look at the eardrum and the ear canal. We want to make sure that there's no wax blocking. And on the picture here, we can see a picture of your eardrum, and this little bone here is actually called the hammer bone.
Okay.
It's attached to the back of the eardrum. So when the eardrum vibrates, the bone vibrates, and it stimulates the hearing organ called the cochlea, which is further on.
And how does my ear look?
It's actually a very clean-looking ear canal, Emily.
Yeah?
Yeah, so it looks great.
I'm really glad. I'm going to have to
Very
tell my ear doctor that. Can you look at my other ear just to see? This is kind of exciting for me. It's really neat how easily you guys can do this. Anything in there?
No, that's also a clean looking ear. So what we're looking for typically is a wax blockage.
Okay.
Wax is thought to be Mother Nature's way of cleaning your ears.
Yeah.
And it's secreted by glands in the ear canal, and then it actively moves dust or dirt out of the ear canal. But I can see your ears are quite clear.
Interesting.
So your earwax is working well.
I feel like I'm proud of myself for absolutely no reason. Maybe we can bring in another subject to have his ears looked at. This is
Josh, and this is Meredith, our assistant, of course.
Okay. And everybody works here at the clinic, so we're not, just dragging people in off the street to look at their ears, even though you can, because it's free to have a hearing test here.
So you can see on Josh's otoscope, he's got a little more wax. This honey-colored substance around the outside of the ear canal is actually earwax. Now, it's not blocking his eardrum, so it's where it should be, but he has more wax in his ears than you do, Emily. Now, when we do earwax removal, we typically use 3 methods. One is is irrigation or flushing. Then we use microsuction to remove the earwax that we dislodge with the water, or we use gentle scraping or curetting to remove the waxes safely and as painlessly as possible.
Interesting. Okay, so that's Josh's other ear, looking pretty good again, right?
Yeah, yeah.
All right. Okay, so that's how easy it is for them to check your ears. Like, there's no, remember the days where you used to have to take something and just like spy into somebody's face? It's so electronic now.
Well, the video otoscope gives us some real advantages. It allows us to see it. And again, this is something that we do offer patients who visit our clinic.
Very cool. Okay, coming up, we're going to do a hearing test, and we're also going to be taking a look at the latest and greatest in terms of hearing aids. Back here at Hearing Well Matters, we are going to demonstrate how easy it is to get your hearing tested. Now, Rob, there's a couple types of tests. Tell me about them.
Yeah, so right now we're doing a hearing test involving pure tones or beeps. We want to do that so we can understand how well a patient picks up different frequency or pitch of tones. That can tell us a lot about the severity of the hearing loss and even where the hearing loss is happening in the hearing system.
Wow.
So that's the first test that we do.
Okay. And all the patient has to do is come in, sit down in a nice, comfortable room. I know the door would be closed, but we kind of wanted to show it for optics. Headphones in and a button to press. That's it.
That's it. It's simple and easy to do. It's just stimulus and response.
Okay, and what is the next type of test?
So the next set of tests are a number of different speech tests. So we want to test how well the patient discriminates speech in both quiet but also in background noise. So right now Meredith is doing some different speech tests on Josh, and one of the most important ones that we do is called speech in noise, because the number one complaint that we get from patients is that when they go to a restaurant or a noisy room, they're just not able to pick up speech against background noise. So that's something that we test for regularly here at Hearing Well Matters.
And I can actually, I'm almost getting to that age now where I'm like, oh, it's so loud, I can't talk in here.
So speech in noise does follow aging. So when you have difficulty picking up sounds in a restaurant or hearing the TV or asking others to repeat or thinking that others are mumbling, those are all typically signs of high-frequency age-related hearing loss.
Now, how long does this whole test take?
The test takes like less than an hour, and once we get done, we write the report up and we send it to the family doctor so they can consider it as part of the patient's overall health.
Okay, and your hearing health has a direct effect on your overall health and well-being. It's all connected, right?
It really is, and that's what the name of the clinic, Hearing Well Matters, really refers to.
Yeah, okay. Coming up, hearing aids. They have got some really, really cool stuff out on the market right now. Make sure you stay with us. There's a lot more coming up in Burlington on Morning Live. What's that? I can't quite hear you. Can you speak louder? Rob, I think you're mumbling. Rob, can you hear me?
I can. Hi, Emily. How are you?
Can you hear me now? These are great. I love this. This is for patients that are nervous about getting anything done. It's just like a little stress toy for Hearing Well Matters, and it's just a big, foamy, squishy ear. But people don't need to be stressed out when they're coming here.
It's very simple.
Yeah.
We try to make it as simple as possible.
Easy, comfortable. People can come in and get their free hearing test. And then, next step, if you do need treatment, Rob has all of that here too. So tell me about what's going on the table.
So with hearing devices, the three big advances in the last few years, first of all, is rechargeability. So the hearing aids that we dispense in the clinic today are all rechargeable. So they come in this format behind the ear or this format that's a custom. But the hearing aids are rechargeable, so you never have to worry about
those little
batteries
tiny
anymore.
batteries.
The second big advance has been in the computing power of the hearing aids and how they use artificial intelligence to help patients hear better. So the hearing aids today have not just one computer chip in them, but they actually have two. And the two computer chips, the one is used for like everyday sound detection and helping you hear better. But the second chip is there to really help hear better with speech and noise, like in that busy restaurant setting.
Wow.
Or the family gathering.
So the lengths that hearing aids have come, say in the last 10 to 15 years, it's been huge. I remember my grandfather's hearing aids. They were this massive, they were 3 times that size. They wrapped around almost this whole portion of his ear in the back, and then there was a big thing, and it was battery operated. So whenever you got close to his ear, you go beep, 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 like you could hear it, right? Like that's gone now.
Correct. Yes. So they're much smaller than they used to be, much more invisible.
Yeah, they're sleek.
And that's important for patients who might be a little bit self-conscious about wearing them. The other big advance with the hearing devices is what we call Bluetooth connectivity.
Yeah.
So the hearing aids are able to connect to different devices like your television or your phone, and you can use your smartphone to navigate the hearing aids, which means you get much better value out of them.
My mind is blown how you can do that. Now you can answer phone calls too, can't you?
You can. So once the hearing aids are paired to the phone, the telephone calls are streamed directly from the phone to the hearing aids.
That is the coolest thing ever.
The other devices are things like a television streamer. So this device hooks up to the TV and it streams the audio signal from the TV directly to the hearing devices that the patient has in the ear, meaning that they don't get any interference and they hear TV much better.
And then if you've got 2 people and one doesn't have hearing loss and the other one does, you don't have to fight over the volume.
Exactly.
Oh,
so
that's
leads to marital bliss.
And what's this last one?
And then the last one is called a multi-mic. So this is a device that can be used in that busy restaurant setting, either as a companion mic, where your dining partner might wear it around their neck or on their lapel, and it beams what they say directly to your ears.
So it's kind of like my lapel mic.
Yeah, and then it can also be used as a table mic if it sits in the horizontal position, and that will help the patient with the hearing aids hear table conversation much better.
Very cool. Okay, you have to come down to Hearing Well Matters. Rob is so great. The staff, the team here, they're so knowledgeable. They'll let you know anything if you have any kind of questions about your hearing. And of course, the hearing tests are free here. May is
Better Speech and Hearing Month.
Okay, so it's a perfect time. No excuses. You got to come down and check it out. We'll have all this information on our website as well at chch.com. Thanks for having us, Rob.
Great, Emily. Nice seeing you again.